News is a team of journalists, activists, and researchers with three key missions. A commitment to show an unfiltered view of the before, during, and after of key events live as it happens. To defend the First Amendment using our rights of a free press. And to amplify the voices of underrepresented individuals including Black, Indigenous, persons of color, and the LGBTQIA+ community. Our team is committed to seeking equality for all and holding those in power accountable. The easiest way to support Malcontent News is to bookmark our website at malcontentnews.com, like and follow us on Facebook, subscribe to us on YouTube, and follow us on Twitter, TikTok, Twitch, Instagram, and in the Google News app. To provide financial support, you can become a patron, make a one-time donation through Venmo, or link your Twitch account to your Amazon Prime account and use your free subscription to subscribe to Malcontent News. Thank you for supporting independent journalism and for being a malcontent. Hey there, Malcontents. This here is the Malcontent. How is everybody doing? Bonus Malcontent. Yeah, that's a good way to put it. I'm like looking up, did I even bother to turn the light on in here? Governor Inslee's office is doing an announcement at about 11 o'clock. We have that queued up. We have that queued up over here. But Dora, how are you doing? We have it queued up over here. They have not gone live. There was a little blurb. If you heard like a little moment of a woman's voice in the background, that was actually coming from the governor's feed, which I've muted out, which actually, let me unmute. That way if they start talking, then we're aware of that. So we know that some counties are going back to phase 2 today. We don't know which counties are going back to phase 2, but we do know that counties are, it seems, all but guaranteed that King County and Snohomish County here in the Puget Sound lowlands will be going back. You're going to see a browser pop up just for 1 second. I need to move it to a different screen. Thank you for your patience with that. I am actually, what I'm looking up right now is if the key indicators, I had looked about, it's been a crazy morning with the real job. No, key indicators out of King County have not been updated yet. One other thing I can look at right now. So Evergreen Hospital updates their COVID patient count once a week. They've gone from 16 to 18, so their number of hospitalizations have gone up. Monroe also has a patient now. That wasn't the case last week. What we don't see, because they're not doing on a daily basis for a while, we're not seeing like the ups and downs. So we know that it has gone up in about a week. Rob, good morning. Shelley, good morning. Amy, good morning. I feel like I'm on Romper Room. I just like totally aged myself. People are like, what's Romper Room? Romper Room was a little weird with the magic beer. So I see we have a spiral of despair on the governor's conference feed. I'm going to hit a hard reset. Nope. Still not seeing anything. Shelley's of a certain age. She remembers the math. I was little teeny tiny kid. I don't even know if Romper Room was, I'll have to look up the years. I don't know if Romper Room was like in reruns when I saw it. There's a lot of shows that when I have my earliest memories that they were in reruns. They weren't OTA anymore. They weren't new episodes going on. No, the feed out of the governor's office, I've just checked like a second source, and the feed has not started. Well, Nanda, I mean, the guidance is if you're outdoors, if you're on a place like the CKC, the guidance out of the CDC is you don't have to wear a mask anymore. Um, that is the current guidance out of there, and the state of Washington has adopted that guidance. Where it gets a little, if you're in large gatherings, if you're in mixed gatherings, then the feedback, of course, is you don't have to wear a mask. I mean, candidly, if it's me, I'm out jogging on the CKC at 6 in the morning. I'm not wearing a mask. With that said, I have a mask with me, and if I'm going to interact with someone, I'm putting my mask on. Okay, here we go. The feed is starting. We're going to go ahead and transition over. And now we just have to hope we have audio. Oh, it sounds like we do. I can hear little shuffling noises.
We all set? Josie, okay. Good morning,
Here we go.
My fellow Washingtonians. Today I'm announcing a 2-week pause on our phased reopening plan. This means all counties for the next 2 weeks will stay in the current phase that they're in this morning. At the end of the 2-week pause, we will evaluate the metrics at that time, the number of cases per 100,000, the hospitalizations. So this is not a change to the phase plan, but we are pausing it for 2 weeks as we continue to evaluate the changing conditions in the state of Washington. This decision is based on the information that we've been able to analyze just in the last few days, as that has come in on a daily basis. And we're responding to what we've learned with that most recent information, as we always have. And I think our flexibility throughout this pandemic has been one of the reasons we've had a great deal of success, that as this virus has thrown us curves, we have responded. It's also worked because of the tremendous compliance we've had with our requirements for masking and social distancing, and a great credit to this goes to the state Washington citizens. Before I talk some more about that, just a word on our vaccination. Today, more than 54% of the eligible Washingtonians have received their first dose of the vaccine, and 38% are now fully vaccinated. Obviously, we want that effort to continue because we have a long ways to go to get to a much safer position in the state of Washington. I have decided on this 2-week pause in consultation with our State Department of Health and experts, because we are in a constantly evolving situation, and unlike any other time during the pandemic, we look at the most recent information literally on a daily basis to make these decisions. For the past several weeks, epidemiologists have observed a fourth wave developing of COVID, as I talked about last week. But the most recent data that has come in just in the last few days, including what DOH has observed over the weekend, shows a potential plateauing of the COVID activity in the state of Washington, which obviously is good news. I'd like to show you the epi curve. First off, I'm going to show you the one that I hope that you can turn your computer so I can see which one is up, please. Okay, this shows the rate of cases going back to November as we see the 2 spikes in December and January. The curve then came down. It started to go up with this fourth surge, but you'll notice just now I'll switch to the next to show a blow up of the last 2 weeks. You'll see that towards the last week or two, we've had essentially a plateauing, particularly in the last several days. On the right side of the curve, it's essentially flat. Maybe if you're a total optimist, even a potential little decline. I wouldn't go so far to say that, but at least a plateauing. So we have seen some continued changes, and as the pandemic has changed, so have we. We know that we've unfortunately had increased hospitalizations. Fortunately, the death rate has gone down dramatically since we started the vaccine effort. and we're very, very happy about that. We attribute these changes to our vaccination progress. There's a reason we're succeeding on this, is because not only have we acted safely, but we're getting shots into arms. And we're pleased that we made priority decisions on who would receive the vaccinations first in a way that has dramatically driven down the death rate, because those who are most vulnerable received the vaccine first. So we're at the intersection of progress and failure, and we cannot veer from the path of progress. Our economy is starting to show early signs of growth. We've had great legislative victories on a number of issues, and we know vaccines are the ticket to full reopening, and we're very pleased about the success to date in that regard. But we need to continue to those efforts. There is reason to have hope that if we were to continue our progress on vaccinations, that sometime in the summer, we could potentially have much more normal activities in our state. But this is dependent on our continuing to increase the vaccination rates. And as you know, we've had some concern about that in the last week or two. So if you have not made an appointment, vaccine for anyone over the age of 16, and we stress that, anyone over the age of 16. Young people are now an increasing percentage of people in our hospitals, so it's not just the senior citizens we're concerned about, it's everyone. Our federal partners are also indicating that we are in the cusp of approval to the vaccination from those of 12 years and older. So if that comes through, we will encourage folks in that direction as well. Now, I can't say enough about what the miracle this is to have this vaccine. These vaccines are desperately wanted across the planet, and we have them right here in the state of Washington. And so we would hate to see that miracle go to waste, and we hope that if you had a vaccine, you'll talk to your loved ones about the necessity and advisability of this. And if you have any questions about the vaccine, we really encourage people to call their medical provider, their physician, their physician's assistant, their dentist, their chiropractor, your dental hygienist, your dentist. They can provide you the best information about this. I talked with the organizations that represented these professions yesterday, and they are going to be very active, both sharing information and advice with their patients, but increasingly being in a position to actually administer the vaccine in these medical settings. We want to provide as much access as we possibly can to folks. So we're confident in our ability to continue to improve, but we got to all keep pulling together. I'd like to take a moment to commend some of our local leadership. Just in the last few days, local health authorities in Ferry County have made their own individual decision to put their county into phase 2. That is a step that represents tremendous leadership on our local partners. The Whitman County Board took similar steps during an outbreak last month, not a phase change necessarily, but other strong measures. So what we're doing today, we want to make sure to reiterate that local officials have the ability to make decisions on their own. And again, I recognize Ferry County's local health decisions. Their decision is going to save lives. It was a stand-up thing to do, and it was a response to a very disappointing super spreader event in Republic, and they took action. Hats off to those leaders in Ferry County, because those folks are helping not only citizens in Ferry County, they help citizens all over the state of Washington, so that super spreader event does not move to the rest of the counties in the state of Washington. So to talk more about this 2-week pause, we have Dr. Umair Shah and Dr. Jeffrey Duchin. Let me call on Dr. Duchin for comments. Jeff, take it away.
Thank you, Governor. Can you hear me?
Yes, we can. Yeah, we hear you, Jeff.
On behalf of Executive Constantine and myself, I want to thank you for the opportunity to provide a brief update and perspective on today's announcement and our situation in King County. In assessing the trajectory of our outbreak and considering response measures, both the number of cases and hospitalizations and the direction of our trend, whether we are rising or falling, are important. Although King County has exceeded the previously announced Phase 2 rollback metrics, the recent increase in the number of cases in King County has leveled off for approximately 2 weeks now and is no longer rising at this time. We've also seen a plateau last week in our emergency department visits for COVID-like illness. And although it's not possible to predict with certainty where we're headed next, in many other areas of the country that experienced the COVID-19 fourth wave, cases have been declining. A 2-week pause recognizes new information about our local disease trends and provides time to see more reliably which direction we're heading in and whether we're turning the corner on the fourth wave, which we very well may be, while we continue to do everything we possibly can to get more people vaccinated, especially younger adults, to decrease our future risk. I think this is a good and I know a difficult decision by the governor to make these late changes in response to the rapidly evolving situation. To paraphrase Miles Davis, the notes you don't play are as important as the ones you do. It's critical to remember that COVID-19 is an airborne disease, and there are important concrete steps that businesses and others can take to improve the air quality in indoor air spaces and reduce the risk for spread of the virus now and for the future. All King County business owners and operators and building managers for restaurants, gyms, and other retail and other public spaces should review and use the new guidance on our website for 3 steps to improve indoor air quality and make our indoor air spaces as safe as possible. And everyone who's out and about should be familiar with these safety measures and look for them to be sure steps are being taken to make the air as healthy as possible in the stores, businesses, restaurants, gyms, and other places you visit. This is also an important moment to highlight that whether we're talking about Phase 2 or Phase 3, the main reason we need these restrictions at all is because not enough of us are vaccinated currently. And unvaccinated people are at risk not only for COVID-19 themselves, but pose a risk of spreading it to others, especially in indoor spaces. Just as we had no playbook to guide us when we experienced the first COVID-19 outbreak in the United States early last year, there's no playbook for the endgame for this pandemic. But I'm sure all of us want to avoid a prolonged game of whack-a-mole with imposing and easing restrictions. Vaccination is the cure for mitigation measure whack-a-mole. Vaccination is our ticket to a more stable and more normal life and lifestyle. And the more people that are vaccinated and the more quickly, the more we will all be able to do, the more quickly we'll be able to do it, and the healthier our community and our economy will be long-term. Thank you again for the opportunity to join you today.
Thanks, Dr. Duchin. I appreciate it. I think what we're hearing is this is not a pause in our vaccination efforts. We need an acceleration of our vaccination efforts. We want to get through this as fast as humanly possible. And everybody who can step up to plate in this regard, we will get it through it fast as humanly possible with increased vaccinations. Before I take questions, I'd like to also address those folks who still have an obligation to continued safe operations in their businesses and in their organizations. Look, non-adherence to our currently existing safety protocols put people in danger. That's just a fact. So most counties still have a 50% capacity limitation for restaurants and other businesses. In 3 counties, it's at 25%. It is our expectation that responsible owners will follow these requirements. And fortunately, the vast majority of our business owners have done that, and that's why we've been successful. A large credit of this goes to those business owners that have complied with these rules. But not everyone has, unfortunately. And I do want folks to know that we take these protocols very seriously. We've had about 100,000 complaints filed over the pandemic that have been filed with our Emergency Operations Center. We've had thousands of inspections, and the department has administered about $7.3 million in fines already for the few folks that are not complying. We'll be continuing that enforcement to make sure that we preserve the safety of all Washingtonians. And again, thank you for those business owners that are complying. complying. We need everyone to do so to get through this, to get people vaccinated. So while we're pausing today, it doesn't mean we're going to pause our efforts. I believe Washington's going to remain committed. The vaccination rates, I hope, will continue and grow. We're going to have stable dosages moving forward. We probably will not have increasing in the near future supplies from the federal government, but they will be stable. So in a sense, that is good news. Dr. Shaw, did you want to say anything before we turn to questions?
Just briefly, Governor, thank you. And I want to also thank Dr. Duchin for joining us today. And, I think he highlighted from the public health standpoint, the concerns that we have, and also the hope, right? We are seeing encouraging signs that what we call the epi curve for cases may be starting to level off across the state. And I'm glad to hear what's happening in King County, and certainly we're watching what's happening throughout the state, including in our smaller jurisdictions, eastern side of the state, as well as what's happening in the Puget Sound area and beyond. This 2-week pause, we know, is going to give us the opportunity to see where we are at the beginning of a trend, and if disease activity in the state is indeed leveling off or even beginning to drop. So it gives us really that important point. So thank you, Governor, for moving in this direction. I think the most important thing that I would echo both what you said as well as Dr. Duchin is the importance of people that are listening to get vaccinated. We know vaccines are our pathway out of this pandemic. If we get enough people vaccinated, we know not only can counties stay open, but we can get out of this pandemic throughout this summer into the fall and beyond. It's been 2.5 weeks since we opened up vaccine eligibility to all who are 16 years of age and above. And I know we've been seeing across the state people helping each other get vaccinated. And I want to just remind everybody of this important adage that if you have gotten vaccinated, your job is not done. Please help someone else get vaccinated as well. We need to be in this together. We absolutely know that vaccines work. We want to make sure that people remember, don't hesitate, vaccinate. And it's also important that while we are in this very difficult and critical time where we're referring to vaccines as our pathway out of this pandemic, we also remind everybody the importance of wearing masks and social distancing and all the other measures that also supplement and complement what the vaccines provide to our residents. 5.5 million plus doses of vaccines have been administered across the state of Washington, and we're making great progress, but we can't do this on our own. And I want to thank all of our local partners on the ground, our local public health jurisdictions. I want to thank all of our tribal vaccine partners, and certainly our private sector and our other healthcare partners who have come together to assure that we are vaccinating across the state of Washington. So no matter who you are, where you live, that you have access to vaccine. And finally, let me just close by saying ultimately that the more every day we can vaccinate one more individual who was not planning on getting vaccinated the day before gets us one day closer to the point where we do not have to move back at all and can continue to move forward as a state. So thank you, Governor. Thank you for your leadership on this. Dr. Duchin, thank you, and Patty Hayes at King County and your executive leadership there. And I just want to thank all of our local health department jurisdictions. We spoke with them today, and I'm hopeful that this pause will allow us to continue to see trends going in the better direction.
Okay, with that, you may fire when ready, Gridley.
All right, up first, we'll go to Rachel LaCourte with AP. Go ahead, Rachel.
Hi, good morning. Governor, given the changing metrics and pauses that we've seen related to the statewide plan over these past few months, at what point do you see handing decision-making on restrictions back to local health officials? As you noted, counties have the authority to roll back on their own, as Ferry County did, so why not hand full authority back to the counties at this point? I'd also like to hear from Jeff Duchin on this as it relates to King County decision-making in this process.
Well, we have found broad desires across the state to have as much comprehensive statewide approach as possible from our local partners. They sometimes have more difficulty making these very difficult decisions than the state does, because when the state does it as a uniform, comprehensive approach, it has the the moral force behind it that's easier to seek compliance with. So this has served us very well in the state of Washington, and for the foreseeable future, we would intend to continue this status. Now, as you've indicated, the counties do have the ability to make independent decisions, as Ferry County did. So they still have the ability to influence their own destiny by having to ratchet down some of these phases. But we do think that our decision-making has been very successful. And I think, you know, I got to tell you, the approach to this pandemic, there's no real playbook to COVID. It's brand new. Nothing was written on the tablets. And we are making very difficult decisions based on the best science we have. And they're all subject to criticism, I understand that. But the proof is in the pudding. Our statewide approach, compared to other states, we've saved, you know, maybe 15, 17,000 lives by having a statewide approach and having, frankly, a state willing to make hard decisions. These decisions are not easy. I can tell you because I've made them. When a business has to curtail its activities, that hurts. And it hurts everybody, including the people making the decision. So a lot of our local folks, I think, are happy that I've taken that on my shoulders, frankly. And I'll continue to do that until it makes sense to do otherwise. Now, as to when this will change in some significant way, it will change when we have a high enough percentage of our population vaccinated that can give us high confidence that our hospitals will not be overwhelmed at some date. We clearly do not have that today because we still are, you know, at maybe 30-some% of people who are fully vaccinated, 38%. So we're way below what we would require to have some degree of confidence that the pandemic would not sweep over the state and shut down our hospital system. We know that can happen. So as I've said, if we continue this pace of vaccinations, we think sometime this summer, we potentially could get to a level of vaccination that would give us confidence where the state could step back, have local decision-making in that regard. But we need to continue that pace of vaccinations. Dr. Duchin, you want to add anything to this?
Thank you, Governor. It's a very interesting question, the question of overlapping authorities. And, you know, if you look at how we've done in Washington State, we have among the lowest COVID-19 case rates and death rates in the nation. And I think that's a tribute to the cohesion that our community showed with great collaboration and speaking with one voice around how we responded to this pandemic. And I think that is in contrast to what you saw in many, both our national leadership at the time and in many other states. And I think that the alignment of overlapping authorities and this cohesion has been to a great extent responsible for our success. We have a very collaborative relationship with the governor in King County. I believe the governor takes very seriously the input from his public health experts at the Department of Health and the local communities. And we look forward to continuing to work together and having a unified approach to resolving this pandemic in Washington State and hopefully throughout the country and throughout the world.
Thank you.
Governor, if I could just add, and Dr. Duchin said this, there is not a decision related to this pandemic on the health and medical side that the governor does not ask for Department of Health's input. And we are continually discussing with the governor's senior leadership team and well beyond all sorts of facets of this response. And so I do want to provide the behind the scenes, just again, look, if you will, at what Dr. Duchin just described, of what's happening from a local level. It's also happening at a state level. And that is also not the case across the country. And so Governor, I did want to add that you and I are on the phone constantly about various issues related to this pandemic, and I'm glad we have that relationship. So thank you.
Yeah, I want to note too that, you know, we gather this intelligence from all over the state of Washington, from multiple sources, not just from the state experts, but from county, city, federal, and otherwise, and private businesses. We talk to on a regular basis to get the most real-time intelligence that we can possibly have going into these decisions. But bottom line, what I can tell you, Rachel, that other states that have taken the approach that the states just abandons its obligations to its citizens and just throws it on these local officials, you've had tens of thousands of more people lose their lives. That is the ultimate justification, rationale, and support for what we've done.
All right, up next, we'll go to Ryan Blethen with the Seattle Times. Go ahead, Ryan.
Yeah, hi. Thanks for taking the question. So what needs to happen to ensure there's a reopening plan in place that can keep pace with the changing numbers and the changing dynamics of the pandemic, and yet give businesses and counties confidence in that reopening plan? And might there be changes to the Healthy Washington plan during this 2-week pause?
Well, this is a very difficult question. It's a very important question because there is a constant tension between predictability and certainty and the ability to respond to changing facts on the ground, rates of infection, hospitalization rates, death rates, and the like. And those things are in tension. I would love to have, last December, give everyone a roadmap of our protocols for the next 6 months. We would have then had certainty for businesses and concrete decision making, but we would have made decisions that would have been wrong ultimately, because this pandemic has been so rapidly changing and frankly so unpredictable. So I think that we have to face the facts that if we are going to save lives and simultaneously keep businesses open, remaining flexible is an important element and virtue and has served us very well. Now in this case, the fact that we're flexible by pausing this, I think is going to make a lot of business people happy. So we chose not to embrace certainty. We decided to embrace flexibility involving changing conditions that have changed fairly markedly over the last few days. So the best thing I can tell you is I am very mindful. We would like to have absolute concrete protocols from here till next, Christmas. But I don't think it's actually the best course for us right now. So we will look at this in the next 2 weeks. We are hopeful that these trends could start to go down. We don't know that they will. They could just go right back up again at an accelerating curve. And I think we have to make decisions based on that situation. We've got to figure out which pitch this virus is throwing at us. And if they're throwing us a curveball, we got to hit a curveball. So we're going to continue generally on that route.
We'll go to Sarah Gensler with McClatchy. Go ahead, Sarah.
If I may, let me add something to that too, because Ryan asked a really important question. Anybody who's frustrated by the changes that we have seen, both in our protocols and during this pandemic, you can do something about that. You can find somebody that hasn't been vaccinated yet, or yourself, and ask them to consider getting vaccinated. That's the solution to our frustration and our anxiety. That's how we get out of this. And so I really want to second what Dr. Shaw said. The governor's not the only potential leader here. Everybody is a potential leader. Physicians, physical therapists, mothers, daughters, sons, nephews. If we all embrace this kind of effort from a community standpoint to all be leaders here, we can knock this thing down. Look, this thing is an extremely effective vaccine. That's one thing we know, and it's also extremely safe. So I just want to encourage anybody that if you get frustrated, don't just get angry, get even with this virus, knock it down, get somebody else to get vaccinated.
Up next, we'll go to Sarah Gensler with McClatchy. Go ahead, Sarah.
So you referenced this level of vaccination that would enable a more substantial reopening. What is that level of vaccination for eligible people that you're looking toward at this point, or is that still to be determined?
That is still to be determined, and I'll tell you why. There's things we don't know and there's things we do know. What we don't know is, at the moment, what level of vaccination in combination with natural immunity would give you a level of immunity that would substantially break the back of this pandemic. That is not known to science as of this moment. You will hear numbers from 70 to 85% of your population to get to that level of breaking the back of the pandemic. So we really don't know what that number is at the moment. But here's what we do know, thankfully. We know that every single person who gets vaccinated is one step closer to that eventual resolution. And it may happen sooner, it may happen later, but we do know that every single person has a role in this. Every family member has a role in this. And we get a step closer every single time somebody gets vaccinated. And we have to act on what we do know, not what we don't know. So we're encouraging people in that direction. And we're continuing to monitor the epidemiological evidence. As you know, we're briefed by the Institute for Disease Modeling every week. And those are extensive briefings. We've asked them to continue the pursuit of answering the question that you've asked. But it's a very, very difficult one to be able to have a firm number right now. But we're making good progress on the number of vaccinations. If we continue this rate, we ought to have some confidence moving forward.
All right, up next, we'll go to Laurel Temkovich with the spokesman review. Go ahead, Laurel.
Hi, Governor. You mentioned that hospitalizations are still kind of going up, and I know that there are some small rural hospitals specifically that are struggling to transfer patients to larger hospitals. So can you explain a little bit more about why put the pause now, even though hospitals are still trying to avoid a major surge, and maybe moving counties back for a few weeks could help those hospitals get a better handle on their cases?
Well, I think you might have been referring to Ferry County. They have had some difficulty because of the super spreader event, and they showed local leadership by making a phase change themselves. I really have not heard of any other counties that are having to transfer patients because of COVID. I don't think that's really the situation right now. Fundamentally, what we believed is that the case rates usually are ahead of the hospitalizations. So the hospitalization, the pace of change up or down lags maybe 2 weeks what the infection rate is, for obvious reasons. It takes time for people to develop symptoms. It takes time for a decision to be made to hospitalize them. And so what we see is that the infection rate is kind of a leading indicator of where you're going. And that, as I've indicated on the charts, if you want to put the chart up again so we can take a look at it, look at the short-term one the last couple of weeks. If you see on this chart, which goes back to March, the beginning of March, in the last couple of weeks or last week of April in any event, we've sort of got this plateauing of infection rates. So that's what's given us a belief that this pause makes sense. We are not, I don't believe, in imminent danger of our hospitalized system. And if we can pause and prevent some disruption of our economy, we think that this is a reasonable step to take. Is it certain to work? No, there's no certainty in this pandemic, but we think it's a reasonable step.
All right, up next, we'll go to Jerry Cornfield with the Everett Herald. Go ahead, Jerry.
Governor, a two-part question. First part on the vaccinations, I'm wondering, obviously you want to accelerate the rate. I'm wondering if the state might be working with organizations, nonprofits, businesses to offer some tangible incentives to get people to get vaccinated, maybe a gift card, a t-shirt, a hat, something like that. And then secondly, science and is a key metric. As you noted, the recent trend has been you've looked at the epi curves. Pierce County's epi curve seems to be showing a decline in cases, and I'm just wondering why Pierce County and Cowlitz and Whitman are not being elevated back to phase 3, given that the trends in those counties seem to be putting them now back in line with those that are not falling back. So why not elevate those 3 to phase 3?
Well, it's because they are so substantially higher than the metrics that we were expecting. Pierce County's, Dr. Shaw, help me out. What are their numbers right now? Do you recall?
We can look it up. I mean,
It's something over 300, as I recall, and there are almost 8 or 9 or 10 hospitalization rate, almost double the numbers we want. So they're just too high to consider that at the moment. And I'm not sure I'd characterize it as really having a decline. So they're, almost twice some of the limitations of the phase change. So we don't think that that made sense. On the vaccination, and by the way, we're pausing this in Pierce County too. We're not changing, Pierce County is not going backwards because of this. We're just pausing the situation. On the incentive issue, we do encourage incentives for vaccinations. And there are, as I indicated last week, there will be an increasing number of incentives that will be available to people to be vaccinated. You'll be able to go to a Mariners game and sit close to people in a vaccinated portion of the stands. You'll be able to have increased participation in your faith organization sitting in a sort of a vaccination sector. And importantly, you'll be able to go to school and colleges. Washington State, University of Washington have now said, here's an incentive. You'll be able to go to college if you become vaccinated. So those incentives are continuing to increase. I think you will continue to see that kind of thing. We have talked to some private companies about incentive packages. I won't go into any detail about right now, but yes, we are talking to them about that kind of thing. And I think that this will increase as more and more people are vaccinated. It's going to make more and more sense for everyone to sign up. So we'll continue to look at those efforts.
Governor, Pierce is 374.5 cases per 100,000 over the last 14 days.
And the limit was 200 for that phase, so we're just way above that number at the moment. And we want to thank people in Pierce County. I know they're working on this. They've done some creative things in their vaccinations. The other thing, in answer to Jerry's question, we think making it these vaccinations as easy to get as possible is something we're focusing on. We're making sure you can get appointments by phone. We're having an increasing number of walk-in clinics. You will see an increasing number of access for physicians to be able to do it in their offices over time. The federal government is also moving in this direction. So we're trying to make it as easy as possible. We think there's a substantial slice of the state that is not really objecting to vaccines. They just haven't kind of got around to it. So we want to make it as easy as possible.
All right. Up next, we'll go to Steve Solis with King 5. Go ahead, Steve.
Good morning. My question is kind of along the same line. There's been a lot of urging from health leaders and local leaders to get the vaccine. What more can be done besides urging? I think that the sense is from people I talk to, a number of things. One is there seems to be just fatigue from hearing, go get the vaccine. And maybe there is more to be done to reach those people. And two, the other thought is they don't want to hunt it down, because I think what's happening is they're hearing from people that have to hunt down an appointment here or there and go to this website and that website. What can be done besides just urging people to get it done?
Well, we're doing everything humanly possible. By the way, you can go to Vax Locator. If we put that up on the screen there, you go to Vaccine Locator, doh.wa.gov, and they'll tell you where it is. 90% of all Americans are within 5 miles of a vaccination site. And as I've said, we're doing everything we can to make it as convenient as possible. The strategy we have pursued is to give people multiple environments to receive it. So people have different tastes. Some people would like a MaxVax site for their convenience. Some would like a local pop-up clinic at a Hispanic shopping center that I visited. Some would like to do it by computer, some by phone. Some would like walk-up clinics. We have increasing numbers of delivery systems for those who can't leave their homes. We are advertising this in 32 languages. So we're doing everything humanly possible to give people multiple avenues. And I would say it's, particularly now that appointments are quite readily available pretty much throughout the state of Washington. We just need people to do this. It's certainly no harder than other medical things you've done in your life, like getting your flu shot or having an exam in your doctor's office. It's a lot faster than that. So we'll continue this effort, do everything humanly possible. But, you know, coming back, somebody asked about incentives. Here's a pretty good incentive. It might save your life. That's a pretty good incentive, we hope, ultimately. Now, we do think, and we always knew, that there was going to be a spectrum of people on where they are in the vaccination. A lot of people were, you know, wanted to get it, willing to drive 100 miles to get it. Some other people only drive 50 miles to get it. Some were willing to make a computer appointment. Some want to wait until there's a walk-up clinic. There was always going to be a spectrum. We're working through that spectrum now. But we got to keep that movement going to get this job done.
Governor, if I could just add, we're doing a number of things across from a Department of Health standpoint to continue to work with our local partners, and that includes, as the governor mentioned, incentives, but also to make vaccine choice the easy choice. We want to make it accessible to people. All the barriers that frankly are real, and then sometimes the barriers are perceived, and we want to do everything we can to remove those and make people recognize that in the midst of their busy day, you know, while they're doing all the other things that they're doing, and we want to thank everybody for what they're doing, that this is so critical, not just for their own health and their family's health, but ultimately for our community's health. And we are really wanting people to work together. So please help each other. Please help your family members. Please help a loved one. Please help somebody that maybe you don't even like that much. Please help them get a vaccine as well, because ultimately this is about all of us together fighting this pandemic. And I think while we have this pause here, it gives us not a pause on the vaccine efforts. We want to make sure to continue to emphasize that. I think Dr. Duton might have also had a comment on that. Jeff?
Thank you, Dr. Shah. Thank you, Governor. Yes, I also just wanted to say that, you know, we understand that some people, particularly young people, may not feel that they're at high risk for COVID. They may feel like it's no big deal. And in a sense, you know, most young people do fine, but there is a number that get very sick, that get long COVID. We don't know the full spectrum of illness and long-term complications from this disease, but even so, it's not only a risk to you, but to those who you come in contact with, your friends, your family members, your coworkers. Outbreaks at workplaces continue to be terribly disruptive to people that are in the community who can't get vaccinated themselves or can't respond to vaccine because they've got an underlying medical condition, immunosuppression, organ transplant, bone marrow transplant, chronic steroids and other medications can put these people at risk. So by getting vaccinated, you not only protect yourself, however much you may or may not value that, but you protect everyone around you. And that is an incredibly important thing for us all, because that's how we get back to community level safety in both individual, community, and economic health.
Nick, did you have something you wanted to add on that one?
I just wanted to build a little bit on the governor's remarks about how we're dealing with the spectrum and how that really evolves and changes, and illustrates that delivering vaccine to residents is a dynamic situation. So we're really dealing with a product adoption curve where you've got early enthusiasts and early adopters that have high demand, and we need to create high throughput sites to help get as many of those people through as possible. But as you're dealing with the back half of the curve and you're trying to get those individuals that are maybe a little more skeptical or conservative, you need to retool that infrastructure to help reach them, because they're possibly less interested in going to those same types of systems you set up to deal with the early adopters and the enthusiasts. So it's a constantly dynamic system, and that's kind of the process that we're starting right now of how do we retool the infrastructure that we've created to help reach the next layer of individuals that we need to get vaccinated.
All right, up next, we'll go to Essex Porter with Cairo 7. Go ahead, Essex.
Good morning, Governor. You've been touching on this, but in our newsroom, we've just received a text from one of the restaurant owners who says he just changed the rules again. How can we trust the process?
Well, I hope that restaurateur is happy that I changed the rules again so he can stay at 50%. I can't believe he wouldn't believe that was a good thing. So really happy that we've changed the rules to allow restaurant owners to stay open at 50%. I have to believe that would be a popular position with the restaurant industry. Now, he can stay at 25% if he'd like. That's his decision. I'm not making him do so. So we think this will be well received.
All right. Up next, we'll go to Casey Decker with CREM. Go ahead, Casey.
Yeah, here in Eastern Washington, the last few weeks, metrics in Spokane County have not been looking great. Meanwhile, Whitman County, which is in phase 2, has been improving to my understanding. Is there any concern that this pause, in a way, for lack of a better term, rewards bad behavior and punishes good behavior in that sense?
No, I just don't think that that's something to worry about. Look, this virus is a slippery critter. It does unpredictable things. We don't look at this as punishment or reward. We look at this as a practical way to try to save lives, and that's how we're making these decisions.
All right. Up next, we'll go to Keith Eldridge with COMO. Go ahead, Keith.
Governor, if indeed the fourth wave is leveling off and perhaps coming down, is there a potential that in 2 weeks or very soon that you'll be able to go without restrictions and really turn to the incentives to get vaccinated that you've been talking about, especially for young people like nightclubs and stuff?
As we've said now many, many times during this pandemic, anything is possible involving this virus. Anything is possible. I would think it would be very surprising to me if we had such a precipitous drop that would allow us to depend only on the vaccines. I think at least for some weeks, at least, we will continue to have to use multiple strategies against this pandemic that includes the vaccine, but also includes some reasonable protections of socially distancing and the like. So it would be very surprising to me if that happened within 2 weeks.
All right. Up next, we'll go to Charles Featherstone with Columbia Basin Herald. Go ahead, Charles.
Good morning, Governor.
Morning.
Actually, believe it or not, you have answered every question I had thought to ask. So,
thank you. Thank you. Thank you. Appreciate that.
All right. Up next, we'll go to Brandy Cruz with Q13. Go ahead, Brandy.
I'll take his question, and I've got two if that's possible. As for the gratitude restaurant owners should feel for today's decision that you referenced when Essex asked you a question, we know that planning for ups and downs for restaurants is hard. It takes time. And there was no indication before 11 a.m. today that you would change your mind, just as there was no indication 3 weeks ago that you were going to change your mind on the metrics until the last minute. So what do you say to skeptics who see all of this as just completely arbitrary? And then second, you've increased capacity for church services, spectator events by allowing them to create these designated seating areas for vaccinated people. Why not let restaurants do the same thing?
Yeah, and answer to your question as far as the vaccination issue, we have considered having different rules, for instance, for a fully vaccinated restaurant. We've given some consideration to that. Could you have 100% occupancy, for instance, for the restaurant that had a full vaccination or a fully vaccinated portion to some degree? And unfortunately, we just had such a lack of compliance. We tried that early in the pandemic. We had a provision that would allow people, if you were in the same household, to have additional capacity. But frankly, there was just a lack of compliance. People were not checking. And so we just had a lack of compliance. That wasn't our fault. It was just folks weren't following the rules. And so we just don't believe there's a meaningful way. And frankly, we've asked the restaurateurs if they wanted such a thing, and they said no. So we offered that to the restaurant industry. Would you like to have a situation where if you had exclusivity for vaccination or something like you're talking about, and they essentially said no. So that was not something they thought was beneficial. And in most restaurants, there aren't enough space to have just an exclusive zone that actually changes the pandemic dimension. So it just practically is not available. The issue about the notice, I am fully aware of the difficulties that people have in this situation. If you're trying to plan how much food to order or plan your staffing, it is a challenge to have these changes. There is no way to diminish the difficulty that the businesses have in that regard. But you have to make a decision. Are you going to save lives and accept some of those difficulties or not? We've made a decision to save lives. And as far as the issue of, well, we didn't get advance notice, look, there's always a decision where you make a decision, and until you make a decision and announce it, you can't give advance notice. If you give advance notice, that's when you've made the decision. So we've decided, we've shared this with as much timeliness as we possibly can. We built into the original system several days from the announcement to the effectiveness so that we would try to ameliorate some of those concerns. But I don't want to diminish why that's difficult for businesses. It is difficult for them. So is watching a loved one die of COVID. And we've made a decision to reduce those tragedies.
Nick, did you have something you wanted to add on that?
Yeah, I just wanted to build on the governor's remarks. You know, we in our office have had a lot of conversations with stakeholders, local elected officials, all through the course of the pandemic, and we fully understand the desire and need to try to have information as early as possible so that way people can acclimate themselves to it, make informed decisions about their business practices. But they also want the decision oftentimes to be a certain and particular decision. And there's always a little bit of push-pull that, you know, you want the answer to be yes, and you also want to know that answer with as much advance notice as possible. And it requires us, as we have said all along, to constantly be reviewing the data, talking to our public health officers like Dr. Duchin and like Dr. Shah to really be able to make these decisions at the earliest time that we can. And so we make the decision today looking at the most recent data that we possibly can review to get a sense of where this pandemic is headed. And unfortunately, that does mean that the decision comes with a little bit of short notice for folks. As a reminder, the announcement today was not set to take effect until Saturday. And so we still had that built-in buffer period, again, at the request of our stakeholders in the business community and restaurants, so that way there was time for them to retool their operations and be able to make any necessary changes if there was phased movement. So we've really tried to construct the system in every way that we can to be considerate and thoughtful while also being responsive to the pandemic.
If I may, too, as far as your comment about skepticism, could we put up the graph again here, just the epigraph showing the last curve? What I would say is that, you know, our strategy generally has not changed that much during the pandemic. What has changed is the pandemic, the virus, the mutations that have taken place that have come in and made it much more, the variety is much more transmittable. And there is something going on that appears in the short period of the last several days to have plateaued these numbers. This is not the governor throwing a dart at a dartboard. It's our government responding to the scientific information that we look in infinite detail. Now, if you look at this graph, what has changed is the numbers on the graph, not the governor or the way the governor approaches this. We respond to changing conditions. It's like you go to the doctor one day and he says, well, you're fine because your vitals are good, and you come in the next week and all of a sudden your blood pressure has gone through the roof. Well, they change what they do, and that's what we're doing here. We're responding to the changing pandemic.
All right, I think we've got time for just one more question. We'll go to Katerina Kutspas with KXLY. Go ahead, Katerina.
Hi, Governor Inslee. You mentioned that state agencies have handed down $7.3 million in penalties to date. Can you explain where most of these fines are coming from and what types of businesses are being fined as well?
Well, it's been a variety. There have been some restaurants. I believe there have been some gyms. There's been some agricultural employers. So there's been a variety. I do want to stress that the vast majority of businesses are complying with this, though, and they're showing leadership to care for their customers and their employees, and we really, really appreciate that. Man, I've seen people go to exquisite lengths to try to keep their customers safe, and we really appreciate that. But there's some scofflaws, and I just want to point out that this still is the law, and you know we have an appropriate expectation it'll be followed.
Any closing remarks?
No, I want to thank everyone for what I hope will be a successful effort to vaccinate Washington. We want to get away from having to make tough decisions that we've made today. I believe it's the right one given the changed circumstances. But let's free ourselves from this. We want total liberty from this pandemic and these pandemic-related restrictions. And the way to get that liberty is available to us. It's in our hands. Our situation, our destiny is in our hands here. And that means getting the vaccine. So I'm hoping people will help Washington and themselves and their families to get this vaccine. That's really the way forward for the state of Washington. And I'll look forward to that. Please be well.
There we go. So give me a second here, because I'm pulling some stuff up. There we go. I can make it that big. And then if I do like this. All right, give me 1 second. Here I have the state dashboard. And let me go ahead and transition over. All right. Actually, let me transition to a different view. This view is fine. So while this was going on, and I'm going to turn down the volume in here so you don't get that Governor Inslee echo effect that we were having a moment ago. Oh, good. That page works now. Yay! Set up a new page on our website. Okay, so let me get into this. This right here is on the website for the Washington State Department of Health. This was last updated as of May 2nd, 11:59 p.m., as you can see right here. And this is providing the metrics and data for the state of Washington for where we're at COVID. So this is all of the state of Washington. So rate per 100K of newly diagnosed, confirmed, and probable cases over the last 2 weeks is at 250.9, which is 50.9 above where we're supposed to be to stay if you're in phase 3. Now, this is statewide. Percent of positive tests is 6.1. You want to be 5% and under, 5 to 7%. Think of it as like you're in the yellow. So it's like it's not bad, but it's not good. Percent of adult staffed acute care beds occupied by patients is at 82% statewide. 82% isn't bad. Excuse me. It's not good. You want to be under 80%. So that it's like 80 to 85%. You're on the line there. Percent of adult ICU staff beds that are occupied is at 78.9%. That is right at the top of yellow. At 80%, you're getting into the red. At 85%, it's bad. ICUs are not designed to be at 100% utilization. They are designed to be at 60 to 80% utilization. Percent of adult ICU staff beds occupied by COVID-19 patients. Again, this is statewide, state of Washington. This is the state of Washington dashboard. That's at 12.8%. That's not good. You want to be 10% or under. That's like almost red. That's orange. That's where we're at today. I see this as a pretty big bet that this plateau is going to continue to hold as a plateau. We did report, if you go to our website yesterday, malcontentnews.com, on the stub to the story, it does say rates are plateauing. So it is true that rates are plateauing. Now, here's the thing is I can go in here and I can deselect everything. When you deselect everything, it keeps. And I can start looking at some specific counties. So if we go to King County, this is the King County number. So King County is at 242.9. That's actually down a hair from last week. Percentage of positive tests, 5.1, right on the marker. If you're at 3 to 5%, that means you are testing at an appropriate level. If you're under 3%, that's actually an indication you're over testing, believe it or not. So 5.1%, we can get pedantic and go 0.1. So 5% isn't terrible. Bed utilization at 84.2%, not good. ICU utilization at 83.2% is right on the ragged edge of red. That's not good. Percent of beds that are occupied with a COVID patient in them at 10.1% is not good. King County numbers aren't good. These are the state numbers. They're not my numbers. I'm not yanking these out of my butt. He's here. This is what I was looking for. These are the state numbers that I'm telling you. So anyway, that's King County. Go look at Snohomish County. King County numbers are bad. So it seems like they're betting on this plateau will hold and start to go the other direction. If we look at Snohomish County's in better shape than King County. They're at 226.9 on the rates. Their positivity rate is at 7%. And again, as I said, that 7%, that's right on the line of the yellow. If they were over 7%, not good. That would show increasing infections. The number at King County, if you're seeing 5.1% positive, indicates a plateauing. Dora, that's basically it. No change because they feel we've hit a plateau in the state, but if we mess it up, we'll be back at it in 2 weeks. So, like at this point, we'll see what they just decide. If we look at Pierce County, Pierce County's horrific. Their positivity rate is 374.2. That's really bad. And their percentages of positive are 11.4%. That is indicative of significant undertesting, widespread transmission, and community spread. If you're over 7%, you're in community spread. This is hyperbole. You're scaring people. This is the state of Washington's dashboard. This is the data they looked at to make the decision they made today. I am just communicating to you the data and accepted ways of analyzing that data. So we looked at Pierce County. We'll look at Ferry County. If we look at Ferry County, just to give you an idea, right? Because one of the things that people, what do you mean Ferry is one of the worst in the country? That's hyperbole and blah, blah, blah. Their rates per 1,000 is 1,024 per 100,000. And their positivity rate is 14.1%. That positivity rate actually is down. So that's gone down. But their rate per 100,000 of people tested of 1,024 is mind-melting. That's really bad. And at 14.1%, you have gross undertesting, which is why you have this 1,024 number, because most of the people, what we've heard in reports, most of the people getting tested in Ferry County are people that are showing up in the hospital in worse shape. What the hospital officials are saying there, they're showing up at the hospital in worse shape than patients were showing up a year ago. Because there is a lot of COVID denial in that part of the world. So that's one of the reasons we are seeing those numbers. I just brought my volume up a little bit. If you're like, he just got louder. Why? I just noticed it was set lower from a previous broadcast. The last one I want to look at is Whitman County. Whitman County is at 8.4% positive and 265.5 rate per. So they don't have an argument to go back to phase 3. Pierce County has no argument to go to phase 3. Then we'll look at Cowlitz, 316.7, positivity rate of 14.4%, which is just awful. Those are really, really bad numbers. The other one, I want to look at one more, which is Yakima County, because Yakima County, last time I looked at it, was really, Yakima is at 96% ICU utilization, Yakima County. So their ICUs are almost maxed out. You don't want to be over 80%. Yakima's at 233.5, so they're about King County, but their positive rate, 11.4% grossly undertested, because of course they are. Because Chud's going to Chud, and there's a fair number of Chuds over there. And then the other issue you have is the migrant community is, no, you can't go get tested because you'll get fired from your farm job if you're not here tomorrow, which then is a whole flippin' problem in itself. All right, so Dorrit, no. What we do know is that the B117 strain out of the UK is becoming the dominant strain in the United States, but they don't have the breakdown on that. We did put up in the comments that the the Indian strain has now been detected in Singapore, so the India strain is getting out. This is the one with this double spike protein variant, which we don't know how good or bad that is. They're trying to figure that out. We know that protein spike variants generally cause a reduction in efficacy of the current batch of vaccines. The exception to that is the Johnson & Johnson vaccine, which has been shown to be particularly effective against the South African variant, and do a little better on the Brazilian variant and on the UK variant. We don't know how that will carry over, if that will carry over in the Indian variant, or if the Indian variant will get over here, right? The big concern was the South African variant. In South Africa, when they discovered that the J&J vaccine was really strong against it, they just came in, and that's why you really don't hear about the South African variant much. The Johnson & Johnson vaccine basically took care of the spread of that. The little pockets that we got here in the United States, the B117, just the one out of the UK, became the more dominant strain out of there. There are a lot of people that believe, I had speculated this 6 months ago, that we won't be in a place, and I talked about this, we're not going to be in a place where anybody who got a COVID vaccine is thinking, yay, and I never have to get a COVID vaccine again in my life. Yeah, no. This is opinion. I have no evidence to back this up. This is opinion. We as a society will probably be living with every 6 to 12 months getting a COVID shot as different variants take a hold, because we as a planet, and this isn't just on the United States, but we as a planet are not coordinating in a public health emergency that impacts everybody on the planet. And that is the fault of all of us. It's just really disappointing, right? Hollywood has these movies, aliens come to show up and they're going to come and destroy us all, and the whole world pulls together, and it's very clear we wouldn't do that. Aliens would just friggin' destroy us while we're arguing amongst ourselves. That's just painfully apparent right now. So that's my guess, is we're living with COVID vaccines for the rest of our life, because unless you eradicate or get herd immunity on a global scale, you will continue to have mutations. Now, not all mutations are bad. Virus mutates all the time. If you didn't pay attention in 7th grade biology class, go get a gosh, I'm drawing a blank on the educational platform there. There's multiple educational platforms. Go take a Biology 101 course. You can find college level courses for Biology 101 that are free. That'll explain to you genetic mutations in cell division. Although technically viruses are essentially protein chains. Anyway, you can just take a class to learn in that. It's constantly mutating. A lot of mutations just die off and disappear. It's when mutations develop that are able to take further advantage of their hosts those mutations do better. But there's an interesting thing. Like, for instance, why has Ebola never exploded across the country? And why was there a concern in 2014 when Ebola got off of the African continent and did get into places like the United States? And all of a sudden there was some concern, right? Like, oh, Ebola's in the United States. Oh, right? And we had case, I believe, at Harborview, if I remember correctly, or a suspected case at Harborview. The reason that Ebola hasn't exploded and why the 2014 outbreak was unique is that Ebola kills its hosts off faster, and there isn't a thing of like asymptomatic Ebola. If you have Ebola, you have symptoms, and people that generally have Ebola symptoms when they get to moderate level are A, not ambulatory, and B, when you see them, you're like, whoa, dude, there's something really wrong with you. And Ebola is not airborne. Ebola is spread by contacts with fluids. Now, you go, but you can get it from people coughing all over. Yes, from the sputum. It's in like saliva and bodily fluids, but it is not aerosolized where COVID is aerosolized. What made the 2014 outbreak unique is that particular variant of Ebola kills about 30 to 35% of the hosts. Instead of killing 60 to 90% of the hosts. So in that outbreak, people who were sick were in it didn't make people as sick, which you might go, well, that's a good thing. Well, in the case of Ebola, it actually wasn't, because people were feeling well enough to get on an airplane, even though he had Ebola, where if they had strains prior to that, you were not well enough to get on an airplane, you were not well enough to get out of bed. And that's why there was this concern, because they wanted to contain this, because they didn't want it to start getting into community transition, which again would be difficult, because with Ebola, it's more about the bodily fluids than it is aerosolization. The concern that people have with COVID is that if we get variants of COVID that become increasingly either contagious, which is the case of the UK, the South African, maybe the Indian variant, we're waiting to hear from that, and the Brazilian variant, all of them are much more contagious than the original variants that appeared back in December or January of last year in China. And in coupling, we get a higher mortality rate and it remains aerosolized, then you get big problems. Right? Because then we're back to where we're at. There is at least one expert that has voiced concern that this will happen in the fall of 2021. One expert out of a lot of other people that aren't pulling on that rope yet. So I would say take it with a grain of salt. Inslee, look who we had to choose from. Jay Inslee, we had Lauren Culp. And what did Lauren Culp want to do? Well, Lauren Culp just wanted to open up the whole friggin' state. His town of Republic, Washington, in Furry County now, as we reported yesterday, Furry County was the second lowest vaccinated county. I don't remember if that was for single shot or dual shot. I believe it was for single shot. I believe for being fully vaccinated, it was in third lowest. I think for single, it was second lowest in the entire state prior to this outbreak that's happening. And now what's happening is Furry County is like, we cannot get our hands on vaccines fast enough because people in the county are like, holy crap, I need to get vaccinated, because it's in their face. It has become very real. You have over 10% of the town sick. One person has died. If you're in a community like Republic with a little more than 1,000 residents and a person's died, every person knows it died. If you have a community like Republic and 10% of the people are now sick, it makes it much harder for the 5 to 10% of that population that are hardcore COVID deniers that have been spewing this COVID denial and you don't need a vax and it's all fake and media and propaganda and microchips and Bill Gates. It's a lot harder when you're, say, a 60-year-old parent and your 35-year-old adult child is now fighting for their life in a hospital in Wenatchee or Spokane. And they're like, it's not sudden onset lung cancer, because that was one of the things. We don't hear about sudden onset lung cancer anymore. That was one of the things, is like, it's not COVID, it's sudden onset lung cancer. Where does this shit come from? Why aren't you treating my lung cancer? And so we're seeing in places like Furry County now, again, the Eagles held this super spreader event, the Fraternal Order of Eagles. And now, because the community is pissed off at them, ironically, because the community went to the event, they just held the event. So I don't know. I mean, I guess you can consequences for actions, but now the Royal Fraternal Eagles is going to be hosting a drive-through vaccination clinic to help drive vaccination in the community. I would not be surprised, right? We'll be able to just watch the numbers in Furry County and watch the vaccination numbers and see what happens with that. That event was on the 9th, 10th, and 11th. It was a weekend. They claim, the organizers claim, it was not an anti-mask event, although some people billed it as an anti-mask event. But that this was a recruitment drive for new members. There was karaoke, live entertainment, dancing, food. It was all indoors. And it's like a scene out of the Twilight Zone over in Furry County. Back to the whole thing on mutations. If we don't get ahead of it, even let's say we become 3 months from now, let's say the United States is like New Zealand or Australia. We got this nailed. And we take a New Zealand, Australian, Israeli approach to this problem, which is, oh my goodness, there are 5 COVID cases in Seattle. We are locking down all of King County for 3 weeks so that we don't have more than 5 cases. And you idiots who brought in the case that infected 4 other people, we're going to figure out who you are. And if you broke any rules, there's going to be hefty fines. This is how Israeli, Australia, and New Zealand is doing it. And this is why these 3 countries are back to normal. Let's say we get to that state. And the same thing's going to apply to Australia and New Zealand. If we don't take this global approach on getting everyone vaccinated and getting to a point that we can slow down the spread, you will continue to get mutations. And when the mutations get into the wild in open societies, then you need an updated COVID shot. And that's it. And genetically speaking, coronaviruses are in the same family as flus and colds. They are genetically, loosely in the same family. That's why your bottle of Lysol said effective on coronavirus before there was COVID-19, because coronavirus is only described that it has all these little spikes on it like a crown or a sun. Coronas. Anyway. I don't think this was Jay Inslee's best performance. I guess yay commerce, yay capitalism. It's in the hands of, I don't know why. Pollen must be starting. Cottonwood. Is Cottonwood going? Is Cottonwood starting? Someone in the comments. I'm used to when I'm in the little thing, right? I could point up. So did the comments. Let me know. Is Cottonwood going again? Because Cottonwood kicks my ass. We'll see where we're at in 2 weeks. We are dependent upon our fellow man to do the right thing, right? So we'll see where we're at in 2 weeks and with our fellow man. And with that, I'm going to say I need to eat. I'm friggin' hungry and malcontent. Out. Keep wearing your mask when you're in a group setting. If you're fully vaccinated, you're outside, you're by yourself. You don't need to wear a mask. I get for some people, it's like, but that makes me look like a Republican. But the reality is, if you're out like on a jogging trail by yourself, no one else is around, you don't have to wear a mask anymore by the CDC guidelines. And I would generally agree with that. So like, follow, share, subscribe, Venmo, Patreon. Peace.